Sure. So mid portion and Achilles, there's a lot of overlap. There's probably more overlap than not. And what we find is that probably the key risk factor is activity and loading and what people do. So progressing activities too fast. But then there's also a whole bunch of other personal or individual risk factors. And they're things like that person's health. So how, if they have any metabolic issues like cholesterol or diabetes, that will also influence the tendon health, but also things like hormonal status in females. Females that are perimenopausal can have issues, as well as amenorrhea when they have an irregular or lack of menstrual cycle. That can be a risk factor. And then there are other risk factors like age that we can't really change very much. So when we're looking at the individual, we need to be considering the whole range of different risk factors that are possible, both from a load point of view, but also a non-load point of view. One of the interesting things is that we think of tendinopathy very much as a load-related problem and as a biomechanical problem. But biomechanical risk factors are probably contributing, but they're a small contributor. So they're not very strong contributors. I see in my practice two broad groups of patients, and they are patients that have very load-related problems and others that have problems that are related to other health conditions, like being overweight, high BMI, cholesterol, hormones, systemic arthropathies, inflammatory problems, and diabetes. So they're a distinct group of patients. And then you've got the other ones, often the younger, more active ones, but also older athletes that have more load-related problems.